Welcome back. We are always encouraged to ask questions about our medications, but if we don't know what questions to ask, we miss out on the opportunity to learn about the medications we're taking and how they might impact our health. Lisa is still with us to talk about what questions you should definitely ask your pharmacist. So before we get into the questions though, Lisa, are there times when we should be asking these questions? Is it when we get a new prescription, even when we're doing a refill? When do we even ask these questions?
Yeah, sure, Beth, that's a great question. So my opinion on that is absolutely every time there's a new prescription, you should be asking these questions. But also, I think it's always good to touch base on refill situations, especially if any of your medical conditions have changed since the last time you filled a prescription, or if you have decided you're going to start a new over-the-counter medication. I think that's a good time to check in with your pharmacist to make sure there's not going to be a potential issue with that. Again, anytime you have concerns or questions is a good time. That's what they're there for.
Great. And what about those folks who say, I don't need to ask my pharmacist any questions. There's tons of information with this bottle they're giving me. I'll just go home and read it.
Right. I think that, initially that might be all right, but you really should take the time to understand what the directions are and the things we're going to get into in a couple of minutes. And a lot of times if you get into that information when you get home, it can be very overwhelming and maybe not necessarily very patient friendly. Also, it's difficult sometimes to really discern what's really clinically important. You might read information on the printout that's sent with you, and it's a slew of information. It's a whole page. Yes, there are opportunities where sometimes those types of side effects might occur. It might be in less than 1% of the population, but your pharmacist can really point out for you what situations specifically apply to you and when you should really be looking for issues of concern. I would always say if you are in a hurry and you can't, or your pharmacist is tied up and you can't necessarily talk with them right then, don't hesitate to give them a call once you get home and you've sat down and tried to digest the information.
Okay, so let's give folks a list of questions that they can ask. What would be first on that list?
Sure, I think then one of the number one most important things is what's the name of my medicine and what is it being used for? For example, I'm taking lisinopril and I'm using it for my blood pressure. Is it you should know the generic. Most medications anymore are available generically. They work as well as their brand name counterparts. They are as effective, but they are less costly. So if there's a brand and a generic, those are typically going to be on the label. But I think it's kind of important to know that because when you're reconciling, making lists, you might think they're two different things and they're actually one and the same. How to take it? Am I taking it as needed? And what does that mean? Are there maximum amounts per day if I'm doing that? Am I taking it scheduled, meaning a set time every single day? If it's twice a day, what times during the day? Am I going to need to take it with a lot of water, or am I going to need to take it on an empty stomach, or am I going to need to take it with food? As a sidebar regarding food, there are some foods that do interact with medications, and we didn't get an opportunity to talk about that early, but I think it's important, and your pharmacist should be pointing that out to you. You should have that on the label of the medicine. If there are certain foods to avoid, a biggie is grapefruit juice. People don't realize that it can interact with over 85 medications and really can be very serious, either decreasing their effectiveness or making them more potent and increasing the risk of adverse drug events. So that's important. And how long are you taking the medicines for? Is it just for 10 days? Do I take it till I feel better? Can I stop it? Those kinds of things.
Okay. So those are sort of the top of the list. What are some of the other questions that folks should ask about taking their medications?
Right, so we've kind of hit on this earlier, and a big thing is drug interactions. Are there any things I need to be looking out for in terms of other medicines? That's usually going to be done at the point of fill. Your pharmacist is going to be looking at those kinds of things. Do you have any allergies that are new that need to be discussed? And then whether those side effects that might occur are serious or not. We talked about that a little bit earlier in the patient information.
Okay, so have we exhausted the list, or are there any other questions you would throw out there?
We could go on and on. I think another important thing is storage. Is it refrigerated? Can it be stored just on the shelf? Are there refills on the medicine? Do I need to talk to my my physician before I get a refill? Can I just refill it myself? Are there any activities that I need to avoid? Some medicines, of course, cause drowsiness, dizziness. We talked about benzodiazepines and opioids earlier. What happens if I miss a dose? I think that's important. Some medicines you can resume at the next dose. Some you need to take it that same day. But also, again, if you forget to ask these questions at the pharmacy, don't hesitate to call if something comes up and you have a question. Your pharmacist will be able to help you.
Okay, and we just have a couple minutes left in the show, so let's spend that time talking about over-the-counter medications. You did mention earlier that those can cause interactions too, whether it's aspirin or a supplement. Is there a specific time when somebody should ask either their pharmacist or their doctor about an over-the-counter medication before they take it?
Yes, absolutely. So it's important to remember these are as significant in terms of the fact that they can cause adverse effects or issues as a prescription. You need to take that seriously and be diligent about that. I would suggest you read the label, and that will give you general information. But anytime you start an over-the-counter medicine and you are taking a prescription medication, it is not a bad idea to check with your pharmacist about that, just to make sure.
Okay, so going back to asking our pharmacist questions, are there questions that you should be asking about your over-the-counter medications?
Sure. I mean, I think most importantly is, will it interact with something that I'm taking? Are there specific side effects to look out for? How long should I take it? A great example of that is medicine used to treat stomach ulcers now that's over the counter, the proton pump inhibitors, Prilosec, and you know, that's a 2-week deal normally. There's reasons why we don't want to take that longer than that, or we can take it as needed. So I think it's important to ask, at least at the minimum, those types of questions.
Okay, and what are some of the common side effects that can happen with over-the-counter medications?
Sure, I think cough and cold is a biggie because we all always, end up with a cough or a cold at some point in time, and it really does depend upon the medication. So medicines for cold, if they have multiple ingredients, can cause drowsiness, dizziness, dry mouth, those kinds of things. The antihistamines, Benadryl, I mentioned that earlier, it's a sedating antihistamine. It can cause drowsiness, and so I think those are kind of the biggies.
Okay, perfect. Lisa, thanks so much. Great
bet,
information. Appreciate you being here, and thank you for tuning in this week. Be sure to join us again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.